Question 1. Risk assessment procedures indicate a significant increase in claim denials and a decline in days in accounts receivable over the past 2 quarters. The executive leadership team is seeking a strategic plan to address these trends and improve overall revenue cycle performance. Considering the current regulatory environment and the need for sustainable financial health, which of the following strategic approaches would best align with best professional practices for revenue cycle management? Option A. Immediately reduce staffing levels in patient access and billing departments to cut operational costs, while simultaneously exploring the implementation of a new, unproven revenue cycle management software. Option B. Prioritize the renegotiation of payer contracts to secure more favorable reimbursement rates, with a secondary focus on automating payment posting without addressing underlying claim submission issues. Option C. Focus on aggressive denial rework and appeals, increasing staffing in the billing department to manage a higher volume of rejected claims, and implementing stricter point-of-service collection policies. Option D. Implement a comprehensive, data-driven analysis of denial trends to identify root causes, optimize front-end processes, enhance payer contract management, and invest in staff training and technology upgrades to support these initiatives. The correct answer is D. Implement a comprehensive, data-driven analysis of denial trends to identify root causes, optimize front-end processes, enhance payer contract management, and invest in staff training and technology upgrades to support these initiatives. Explanation. This scenario presents a common challenge in revenue cycle management, where strategic planning must align with evolving regulatory landscapes and organizational goals. The challenge lies in balancing the immediate need for revenue optimization with the long-term implications of strategic decisions on compliance, patient satisfaction, and operational efficiency. Careful judgment is required to select a strategic approach that is not only financially beneficial, but also ethically sound and legally compliant within the specified regulatory framework. The correct approach represents best professional practice because it prioritizes a comprehensive, data-driven evaluation of the entire revenue cycle. This includes assessing current performance against industry benchmarks and regulatory requirements, identifying root causes of inefficiencies, and developing a multifaceted strategy that addresses both immediate and systemic issues. This approach aligns with the principles of good governance and responsible financial management, ensuring that strategic decisions are informed, sustainable, and compliant with all applicable laws and guidelines. It fosters a proactive rather than reactive stance, mitigating risks and maximizing long-term value. An incorrect approach that focuses solely on aggressive denial management without understanding the underlying reasons for denials represents a significant regulatory and ethical failure. This could lead to violations of payer contracts and potentially anti-kickback statutes if the focus shifts from legitimate billing to maximizing payments through questionable means. It also fails to address the root causes of denials, leading to repeated issues and increased administrative burden, which is an inefficient use of resources. Another incorrect approach that emphasizes immediate cost-cutting in patient access and billing staff without a corresponding investment in technology or training is ethically problematic. This can lead to decreased patient satisfaction due to longer wait times and errors in registration and billing, potentially impacting patient access to care. From a regulatory standpoint, it can result in increased claim errors and rejections, leading to noncompliance with timely filing limits and other payer requirements. Finally, an approach that prioritizes implementing new technology without a thorough assessment of its integration with existing systems and staff training is a failure in due diligence. This can lead to operational disruptions, data integrity issues, and ultimately, a negative impact on revenue cycle performance. Ethically, it can result in staff frustration and burnout, and from a regulatory perspective, it could lead to inaccurate billing and reporting, potentially violating compliance standards. The professional decision-making process for similar situations should involve a structured approach. 1. Define the strategic objective clearly, ensuring it aligns with organizational mission and regulatory compliance. 2. Conduct a thorough root cause analysis of current revenue cycle performance, utilizing data analytics and stakeholder input. 3. Evaluate potential strategies against regulatory requirements, ethical considerations, and operational feasibility. 4. Develop a phased implementation plan with clear metrics for success and risk mitigation strategies. 5. Continuously monitor performance and adapt the strategy as needed, ensuring ongoing compliance and optimization. Question 2. Governance review demonstrates a significant increase in claim denials and a corresponding rise in uncompensated care write-offs over the past fiscal year. Analysis of the denial trends reveals a substantial portion are attributed to incorrect patient demographic information and invalid insurance identification numbers submitted at the time of registration. Which of the following stakeholder-focused strategies is most likely to address the root cause of this revenue cycle challenge? Option A. Implement a comprehensive retraining program for front-end registration staff, focusing on data verification protocols and the importance of accurate patient information capture, coupled with enhanced system edits at the point of registration. Option B. Propose immediate renegotiation of payer contracts to include more favorable denial management clauses and extended payment timelines. Option C. Initiate aggressive follow-up procedures with payers for all denied claims, emphasizing the urgency of claim adjudication and payment. Option D. Invest in advanced revenue cycle management software with sophisticated denial prediction algorithms to flag potential issues before claim submission. The correct answer is A. Implement a comprehensive retraining program for front-end registration staff, focusing on data verification protocols and the importance of accurate patient information capture, coupled with enhanced system edits at the point of registration. Explanation. Scenario analysis. This scenario is professionally challenging because it requires navigating the complex interplay between various stakeholders in the revenue cycle, each with distinct motivations and responsibilities. Misunderstanding or mismanaging these roles can lead to significant financial losses, compliance issues, and damaged relationships. The challenge lies in identifying the root cause of revenue leakage and proposing a solution that addresses the systemic issues rather than just the symptoms, all while adhering to the specific regulatory framework of the Certified Revenue Cycle Executive Exam. Correct approach analysis. The correct approach focuses on a comprehensive review of the patient registration process and its impact on downstream revenue cycle functions. This aligns with best professional practice by acknowledging that accurate patient demographic and insurance information at the point of registration is foundational to successful billing and collections. Regulatory frameworks, such as those governing healthcare billing and payer contracts, implicitly or explicitly require accurate data capture to ensure proper claim submission and reimbursement. Ethically, it promotes transparency and fairness to the patient by ensuring they are billed correctly and that their insurance is utilized appropriately. This approach addresses the core of revenue leakage by preventing errors before they propagate through the system. Incorrect approaches analysis. One incorrect approach focuses solely on increasing collection efforts without addressing the initial data integrity issues. This represents a regulatory failure because it may lead to aggressive collection tactics that violate consumer protection laws or payer contract terms regarding timely and accurate billing. Ethically, it is unsound as it places the burden of systemic errors on the patient or guarantor, potentially leading to undue financial hardship. Another incorrect approach suggests renegotiating payer contracts without first optimizing internal processes. This is professionally unsound because it attempts to solve a problem that may stem from internal inefficiencies rather than payer policies. It could lead to wasted resources and time, and may not yield the desired results if the underlying issues of inaccurate billing or registration remain unaddressed. From a regulatory perspective, it might also violate good faith negotiation principles if the organization is not prepared to demonstrate its own operational efficiency. A further incorrect approach proposes investing in new billing software without analyzing the current workflow and identifying specific bottlenecks. This is a superficial solution that fails to address the root cause. It represents a potential financial mismanagement and a failure to adhere to prudent operational oversight, which are implicit in regulatory compliance. The ethical failure lies in potentially squandering organizational resources on a solution that may not solve the problem, impacting the organization's ability to serve its patients effectively. Professional reasoning. Professionals should adopt a systematic, data-driven approach to revenue cycle management. This involves 1. Understanding the end-to-end revenue cycle process. 2. Identifying key performance indicators, KPI, for each stage. 3. Analyzing data to pinpoint root causes of revenue leakage or denials. 4. Prioritizing interventions based on their potential impact and feasibility. 5. Collaborating with all stakeholders, patients, providers, payers, administrative staff to implement and sustain improvements. 6. Ensuring all processes and interventions comply with relevant regulations and ethical standards. Question 3. Which approach would be most effective for a certified revenue cycle executive to improve charge capture processes within a healthcare organization, considering the perspectives of clinical staff, coding departments, and payers? Option A. Establish strict performance metrics for coding staff with significant financial penalties for any identified coding errors, regardless of the underlying cause. Option B. Implement a comprehensive training program for clinical staff on proper documentation and coding guidelines, coupled with regular feedback sessions to address identified documentation gaps and promote collaborative problem-solving with coding and billing teams. Option C. Prioritize the speed of charge entry by clinical staff, encouraging them to submit charges as quickly as possible to reduce backlogs, even if it means some documentation may be incomplete initially. Option D. Rely primarily on automated billing system edits to catch all charge capture discrepancies, minimizing human intervention in the charge entry process. The correct answer is B. Implement a comprehensive training program for clinical staff on proper documentation and coding guidelines, coupled with regular feedback sessions to address identified documentation gaps and promote collaborative problem-solving with coding and billing teams. Explanation. This scenario is professionally challenging because it requires balancing the need for accurate and timely charge capture with the potential for errors that could lead to financial loss or regulatory noncompliance. The revenue cycle executive must consider the perspectives of multiple stakeholders, including clinical staff, coding professionals, billing departments, and ultimately, the patient and payers. Careful judgment is required to implement processes that are both efficient and compliant. The correct approach represents best professional practice because it prioritizes a collaborative, education-focused strategy to improve charge capture. This aligns with the principles of effective revenue cycle management, which emphasizes proactive problem-solving and continuous improvement. By involving frontline staff in identifying and resolving issues, and by providing ongoing education, this approach fosters a culture of accuracy and compliance. This is crucial for adhering to regulations such as the False Claims Act and the Anti-Kickback Statute, which prohibit knowingly submitting false or fraudulent claims for payment. Furthermore, it supports the integrity of patient records and billing, ensuring that services rendered are accurately documented and billed, thereby minimizing the risk of payer denials and audits. An incorrect approach that focuses solely on punitive measures for coding errors fails to address the root causes of charge capture issues. This can lead to staff defensiveness, decreased morale, and a reluctance to report problems, ultimately hindering accurate charge capture. Ethically, it can be seen as creating a hostile work environment and may not align with organizational values of teamwork and support. From a regulatory standpoint, while accuracy is paramount, a punitive approach alone does not guarantee improved compliance and could inadvertently lead to underreporting of services if staff fear repercussions. Another incorrect approach that relies solely on automated edits without human oversight is also problematic. While automation can enhance efficiency, it may miss nuanced clinical documentation or unique patient scenarios that require human interpretation. This can lead to incorrect denials, lost revenue, or even the submission of inaccurate claims if the automated system is not properly configured or updated. This approach risks violating payer policies and potentially the principles of accurate billing, which require that claims reflect services actually provided and documented. A third incorrect approach that prioritizes speed over accuracy in charge entry can lead to significant downstream problems. Rushing the process increases the likelihood of errors in patient identification, service codes, or modifiers. These errors can result in claim rejections, extensive rework by billing staff, delayed payments, and increased administrative costs. From a regulatory perspective, submitting inaccurate claims, even unintentionally due to haste, can be viewed as a failure to exercise due diligence, potentially leading to scrutiny from payers and regulatory bodies. The professional decision-making process for similar situations should involve a comprehensive assessment of the current charge capture process, identifying specific pain points and their root causes. This includes gathering input from all relevant stakeholders. Based on this assessment, a strategy should be developed that emphasizes education, process improvement, and technology utilization, all within a framework of regulatory compliance and ethical practice. Continuous monitoring and feedback loops are essential to ensure ongoing accuracy and effectiveness. Question 4. The review process indicates a significant lag between patient discharge and the submission of clean claims, resulting in delayed reimbursement and increased accounts receivable days. This lag appears to stem from a lack of coordinated communication and standardized workflows between the clinical documentation team, the health information management department, and the billing department. Which of the following approaches best addresses this implementation challenge to improve revenue cycle efficiency? Option A. Implement a performance incentive program for the billing department that rewards faster claim submission without altering existing documentation or communication processes to motivate staff to expedite their tasks. Option B. Conduct a series of training sessions for the billing department on advanced coding techniques without involving clinical or HIM departments in the training or process review to improve claim accuracy and reduce rejections. Option C. Invest in advanced revenue cycle management software with enhanced automation features to streamline the claims submission process, assuming the technology will inherently resolve the workflow and communication issues. Option D. Establish a dedicated cross-functional revenue cycle task force comprised of representatives from clinical, HIM, and billing departments to analyze current processes, identify bottlenecks, and collaboratively develop and implement standardized workflows and communication protocols. The correct answer is D. Establish a dedicated cross-functional revenue cycle task force comprised of representatives from clinical, HIM, and billing departments to analyze current processes, identify bottlenecks, and collaboratively develop and implement standardized workflows and communication protocols. Explanation. The review process indicates a common implementation challenge in revenue cycle management: the disconnect between clinical operations and billing departments, leading to inefficiencies. This scenario is professionally challenging because it requires navigating the complex interplay of different departmental priorities, communication barriers, and established workflows, all while aiming to optimize financial performance without compromising patient care or regulatory compliance. Careful judgment is required to identify the root cause of the revenue cycle lag and implement solutions that foster collaboration rather than conflict. The correct approach represents best professional practice because it directly addresses the core issue of stakeholder engagement by establishing a cross-functional team. This team, comprising representatives from clinical, administrative, and billing departments, is empowered to collaboratively analyze the revenue cycle, identify bottlenecks, and develop integrated solutions. This aligns with the principles of effective revenue cycle management, which emphasizes communication, transparency, and shared responsibility. By fostering a collaborative environment, this approach ensures that all perspectives are considered, leading to more sustainable and effective improvements. Furthermore, this proactive engagement with all relevant stakeholders is crucial for maintaining compliance with regulations such as the False Claims Act and Stark Law, which require accurate billing and avoidance of improper financial arrangements. By ensuring that all parties understand and adhere to billing and coding guidelines, an incorrect approach that focuses solely on implementing new billing software without addressing the underlying communication and workflow issues fails to recognize the human element of revenue cycle efficiency. This approach is professionally unacceptable because it is a superficial fix that will likely lead to continued inefficiencies and potential compliance risks. It ignores the fact that technology alone cannot solve process and people-related problems. From a regulatory perspective, this could lead to continued inaccuracies in claims submission, potentially violating the Medicare Secondary Payer (MSP) rules if not properly coordinated with other payers, and could also be seen as a failure to exercise due diligence in managing the revenue cycle effectively, which could be scrutinized during audits. Another incorrect approach that involves solely increasing the workload of the existing billing staff without addressing the root causes of the delays is also professionally unacceptable. This approach is unsustainable and can lead to burnout, increased errors, and a decline in staff morale, ultimately hindering revenue cycle efficiency. Ethically, it places an undue burden on staff without providing the necessary support or resources. This can also indirectly lead to compliance issues, as overworked staff are more prone to making errors in coding and claim submission, potentially violating the anti-kickback statute if the pressure to collect revenue leads to improper billing practices. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the problem. Clearly define the specific revenue cycle inefficiencies observed. 2. Stakeholder analysis. Identify all relevant stakeholders and their roles in the revenue cycle. 3. Root cause analysis. Investigate the underlying reasons for the inefficiencies, focusing on process, people, and technology. 4. Collaborative solution development. Engage stakeholders in brainstorming and developing solutions that address the root causes. 5. Implementation and monitoring. Implement the chosen solutions and establish metrics to track their effectiveness. 6. Continuous improvement. Regularly review and refine processes to maintain optimal revenue cycle performance and compliance. Question 5. The analysis reveals that a hospital's revenue cycle department is reviewing its charge capture processes to ensure compliance with federal healthcare regulations. A new initiative aims to streamline billing by focusing on physician sign-off as the primary validation for all charges. Which of the following documentation requirements for charge capture best aligns with the regulatory framework for accurate and compliant billing? Option A. Implementing a policy where charges are submitted as soon as a physician indicates intent to provide a service, with documentation to be completed retrospectively. Option B. Encouraging staff to bill what you can based on the physician's general intent, with the understanding that documentation can be supplemented later if questioned. Option C. Ensuring that all documentation supporting a billed service is complete, accurate, and contemporaneous with the service provided, and that this documentation supports medical necessity and appropriate coding. Option D. Relying solely on the physician's signature on the encounter form as sufficient evidence that the service was rendered and is billable. Correct answer is C. Ensuring that all documentation supporting a billed service is complete, accurate, and contemporaneous with the service provided, and that this documentation supports medical necessity and appropriate coding. Explanation. The analysis reveals a common challenge in revenue cycle management, ensuring accurate and compliant charge capture documentation. This scenario is professionally challenging because it requires a deep understanding of the specific regulatory framework governing healthcare billing and documentation, which in the U.S. is primarily dictated by the Centers for Medicare and Medicaid Services, CMS, and enforced through various acts like the False Claims Act. The pressure to maximize revenue can sometimes lead to shortcuts in documentation, creating a significant risk of noncompliance, audits, and financial penalties. Careful judgment is required to balance operational efficiency with the stringent legal and ethical obligations. The correct approach represents best professional practice because it prioritizes adherence to the regulatory framework for charge capture documentation. This involves ensuring that all documentation supporting a billed service is complete, accurate, and contemporaneous with the service provided. This aligns with CMS guidelines, which require that services billed must be supported by adequate documentation in the patient's medical record. This documentation serves as proof that the service was medically necessary, appropriately rendered, and correctly coded, thereby preventing fraud and abuse. Best practice dictates a proactive approach, including regular training, internal audits, and clear policies and procedures to ensure all staff understand and follow these requirements. An incorrect approach that focuses solely on the physician's signature as the sole determinant of charge capture accuracy is professionally unacceptable. This fails to acknowledge that the physician's signature validates the medical record, but the underlying documentation must also support the medical necessity and appropriateness of the service billed. Without comprehensive documentation of the service itself, the physician's signature alone does not satisfy regulatory requirements and can lead to improper payments. This approach risks violating the False Claims Act by submitting claims for services not adequately documented or supported. Another incorrect approach that relies on a bill what you can mentality, without strict adherence to documented services and medical necessity, is a direct violation of federal healthcare regulations. This approach is inherently fraudulent and unethical, as it suggests an intent to bill for services that may not have been rendered or adequately documented, or that were not medically necessary. This directly contravenes the principles of accurate billing and can result in severe penalties, including exclusion from federal healthcare programs. A third incorrect approach that prioritizes speed of billing over the completeness and accuracy of supporting documentation is also professionally unacceptable. While timely billing is important for cash flow, it cannot come at the expense of regulatory compliance. Incomplete or inaccurate documentation can lead to claim denials, recoupments, and audits. More importantly, it can be interpreted as a deliberate attempt to circumvent proper billing procedures, potentially leading to accusations of fraud and abuse. The professional reasoning process for similar situations should involve a risk-based assessment. First, understand the specific regulatory requirements for charge capture documentation in the relevant jurisdiction, e.g., CMS guidelines for Medicare/Medicaid in the U.S. Second, evaluate current processes against these requirements, identifying any gaps or areas of potential noncompliance. Third, implement robust internal controls, including regular staff training, clear policies and procedures, and ongoing monitoring and auditing. Fourth, foster a culture of compliance where accuracy and integrity in documentation are paramount, encouraging staff to raise concerns without fear of reprisal. Finally, stay updated on regulatory changes and adapt processes accordingly. Question 6. Strategic planning requires a thorough understanding of the impact of medical coding on revenue cycle performance. Considering the U.S. regulatory framework for healthcare billing and reimbursement, which of the following approaches best ensures both accurate financial outcomes and compliance with coding guidelines? Option A. Utilizing a generalized approach to coding that assumes most payers have similar reimbursement methodologies and coding requirements, minimizing the need for specific payer research or adherence to detailed payer edits. Option B. Focusing solely on identifying opportunities to maximize reimbursement by interpreting coding rules in the most favorable light for the provider, even if it stretches the boundaries of established coding conventions. Option C. Establishing a dedicated coding review team that regularly audits submitted claims against the latest official ICD, CPT, and HCPCS coding guidelines, payer-specific edits, and documentation requirements, with a focus on identifying and correcting any discrepancies before final submission. Option D. Implementing a system that prioritizes rapid claim submission by relying on historical coding patterns and internal staff expertise, without regular updates to coding manuals or payer policies. The correct answer is D. Implementing a system that prioritizes rapid claim submission by relying on historical coding patterns and internal staff expertise, without regular updates to coding manuals or payer policies. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how medical coding directly impacts the financial health and compliance of a healthcare organization. The accurate and compliant application of ICD, CPT, and HCPCS codes is not merely an administrative task, but a critical component of revenue cycle management, directly influencing reimbursement, regulatory scrutiny, and the organization's ability to provide continued patient care. Misinterpretation or misapplication of coding guidelines can lead to significant financial losses through underpayments or overpayments, and can also result in severe compliance penalties under regulations like the U.S. False Claims Act and HIPAA. The correct approach, which involves a comprehensive review of coding practices against current official coding guidelines and payer-specific requirements, represents best professional practice. This aligns with the fundamental principles of accurate medical record documentation and billing, as mandated by CMS, Centers for Medicare and Medicaid Services, and enforced through audits. Adhering to these guidelines ensures that claims submitted are truthful, accurate, and reflect the services rendered, thereby maximizing legitimate reimbursement while minimizing compliance risks. This proactive stance demonstrates a commitment to ethical revenue cycle management and operational integrity. An incorrect approach that focuses solely on maximizing reimbursement without regard for coding accuracy or payer rules is ethically and regulatorily unsound. This could lead to upcoding or unbundling services, which are fraudulent practices that violate the U.S. False Claims Act and can result in severe penalties, including exclusion from federal healthcare programs. Another incorrect approach that prioritizes speed over accuracy, leading to a high volume of claims processed with potential coding errors, demonstrates a failure to uphold professional standards and a disregard for the downstream financial and compliance consequences. This can result in claim denials, increased audit risks, and damage to the organization's reputation. A third incorrect approach that relies on outdated coding resources or internal interpretations without consulting official updates ignores the dynamic nature of coding regulations and payer policies, increasing the likelihood of noncompliance and revenue leakage. The professional reasoning process for navigating such situations involves a continuous cycle of education, validation, and adaptation. Professionals must stay abreast of the latest ICD, CPT, and HCPCS coding updates, official coding guidelines, e.g., from the AMA and CMS, and payer-specific policies. They should implement robust internal auditing processes to identify and correct coding errors proactively. When faced with complex coding scenarios or payer disputes, seeking clarification from official sources, coding experts, or payer representatives is crucial. Ultimately, the decision-making framework should prioritize accuracy, compliance, and ethical practice above all else, ensuring that the revenue cycle functions efficiently and legitimately. Question 7. The risk matrix shows a potential gap in understanding the fundamental definition and components of the revenue cycle within the organization. Which of the following best defines the revenue cycle and its essential components for effective revenue cycle management? Option A. The revenue cycle is the system for receiving payments directly from patients and insurance companies after services have been rendered. Option B. The revenue cycle encompasses only the management of denied claims and the collection of outstanding patient balances. Option C. The revenue cycle is primarily the process of submitting claims to payers and posting the payments received from them. Option D. The revenue cycle is the comprehensive process of patient registration, insurance verification, charge capture, coding, billing, payment posting, denial management, and account resolution, aimed at optimizing financial performance and ensuring compliance. The correct answer is D. The revenue cycle is the comprehensive process of patient registration, insurance verification, charge capture, coding, billing, payment posting, denial management, and account resolution, aimed at optimizing financial performance and ensuring compliance. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of the revenue cycle's foundational components and their interconnectedness, rather than a superficial identification of individual steps. The Certified Revenue Cycle Executive exam emphasizes the strategic and operational integration of these components to ensure financial health and compliance. Careful judgment is required to distinguish between a comprehensive definition and a fragmented or incomplete one. The correct approach represents best professional practice because it accurately defines the revenue cycle as a holistic process encompassing all financial transactions from patient registration to final payment and account resolution. It correctly identifies key components such as patient demographics, insurance verification, charge capture, coding, billing, payment posting, denial management, and collections. This comprehensive view aligns with regulatory expectations for efficient and compliant revenue cycle management, ensuring all aspects are addressed to maximize reimbursement and minimize financial leakage. An incorrect approach that focuses solely on billing and payment posting fails to acknowledge the critical upstream processes like accurate patient registration, insurance verification, and charge capture, which are essential for preventing denials and ensuring correct reimbursement. This oversight represents a regulatory failure to implement robust internal controls, as often mandated by healthcare regulations, that require accurate financial record-keeping and billing practices. Another incorrect approach that emphasizes only denial management and collections overlooks the proactive measures needed to prevent denials in the first place. This is an ethical failure, as it suggests a reactive rather than a proactive approach to patient financial responsibility and payer relations, potentially leading to increased uncompensated care and noncompliance with payer contracts. A third incorrect approach that defines the revenue cycle as simply the process of receiving payments from patients and payers ignores the complex administrative and clinical processes that precede payment, such as accurate coding and documentation. This demonstrates a lack of understanding of the full scope of revenue generation and could lead to significant compliance issues related to accurate billing and coding practices, potentially violating regulations like the False Claims Act if inaccurate claims are submitted. The professional reasoning process for similar situations should involve 1. deconstructing the core definition of the revenue cycle into its fundamental stages. 2. Evaluating each proposed definition against the established best practices and regulatory requirements for revenue cycle management. 3. Identifying which definition most accurately and comprehensively reflects the end-to-end process, including all critical touchpoints and their interdependencies. 4. Considering the implications of each definition for operational efficiency, financial performance, and regulatory compliance. Question 8. During the evaluation of a hospital's quarterly revenue cycle performance, a revenue cycle executive discovers a pattern of coding discrepancies where certain high reimbursement procedures appear to be consistently coded at a higher acuity level than supported by the patient documentation. While this practice has contributed positively to the current quarter's revenue targets, the executive suspects it may be non-compliant with Medicare coding guidelines and could lead to significant overpayments if audited. The executive is under pressure from senior leadership to maintain or exceed revenue growth projections. Option A. Ignore the coding discrepancies, as they have positively impacted the current revenue cycle performance and no formal audit has been initiated, assuming the risk of future discovery is low. Option B. Advise senior leadership that the current coding practices are contributing to revenue targets and recommend continuing the practice while monitoring for any potential audit flags, without initiating an immediate corrective action. Option C. Instruct the coding department to adjust the documentation retrospectively to align with the higher acuity codes, thereby justifying the current billing practices and avoiding immediate revenue loss. Option D. Immediately initiate a comprehensive review of the identified coding patterns. Engage the coding and compliance departments to investigate the root cause of the discrepancies and implement corrective actions to ensure accurate coding and billing, even if it means a reduction in reported revenue for the current period. Correct answer is D. Immediately initiate a comprehensive review of the identified coding patterns. Engage the coding and compliance departments to investigate the root cause of the discrepancies and implement corrective actions to ensure accurate coding and billing, even if it means a reduction in reported revenue for the current period. Explanation. This scenario presents a professional challenge because it forces a revenue cycle executive to balance financial pressures with ethical obligations and regulatory compliance within the U.S. healthcare framework. The pressure to meet financial targets can create a temptation to overlook or minimize compliance issues, which could have severe consequences. Careful judgment is required to ensure that revenue maximization efforts do not compromise patient care, data integrity, or adherence to laws like the False Claims Act and HIPAA. The correct approach represents best professional practice because it prioritizes accurate and compliant billing, even when it means a potential short-term reduction in revenue. This aligns with the core principles of ethical healthcare revenue cycle management, which emphasize integrity, transparency, and patient well-being. By proactively addressing the coding discrepancy and initiating a correction, the executive demonstrates a commitment to accurate financial reporting and avoids potential penalties associated with fraudulent or erroneous billing. This approach upholds the organization's reputation and fosters trust with patients, payers, and regulatory bodies. An incorrect approach that involves ignoring the discrepancy or attempting to write it off without proper investigation and correction is a direct violation of regulatory requirements. This could be construed as deliberate indifference to or active participation in fraudulent billing practices, violating the False Claims Act. Such an action also undermines the integrity of financial records, which is a fundamental ethical and legal obligation. Another incorrect approach, such as attempting to retroactively change documentation to justify the incorrect coding without a genuine basis, constitutes falsification of records. This is a serious ethical breach and a violation of numerous healthcare regulations, including those related to accurate medical record keeping and billing. It also exposes the organization to significant legal and financial penalties. Finally, an approach that involves delaying the correction indefinitely to avoid immediate financial impact is also professionally unacceptable. While not as overt as falsification, it still represents a failure to act with due diligence and can lead to the accumulation of improper payments, which will eventually need to be addressed and could result in penalties for failure to self-report. The professional decision-making process for similar situations should involve a clear understanding of the organization's compliance program, a commitment to ethical conduct, and a willingness to escalate issues when necessary. Professionals should 1. Identify the discrepancy and its potential implications. 2. Consult relevant internal policies and external regulations. 3. Seek guidance from compliance officers or legal counsel if uncertainty exists. 4. Prioritize accurate and compliant actions over immediate financial gains. 5. Document all actions taken and the rationale behind them. Question 9. Operational review demonstrates a significant increase in claim denials attributed to incomplete medical documentation and incorrect coding for specific procedures. The revenue cycle executive team is tasked with developing and implementing a strategy to mitigate these denials. Which of the following approaches best aligns with best professional practices for denial prevention and regulatory compliance? Option A. Increase the number of staff dedicated to appealing denied claims, focusing on expediting the appeals process to recover lost revenue quickly. Option B. Implement a comprehensive training program for clinical staff on accurate and complete medical record documentation, coupled with enhanced coding audits and feedback loops to identify and correct coding errors before claim submission. Option C. Focus solely on updating the billing system's edits to flag common denial reasons, without addressing the root causes in documentation or coding practices. Option D. Temporarily relax documentation requirements for high-volume procedures to speed up the billing cycle and reduce the backlog of claims. The correct answer is B. Implement a comprehensive training program for clinical staff on accurate and complete medical record documentation, coupled with enhanced coding audits and feedback loops to identify and correct coding errors before claim submission. Explanation: this scenario is professionally challenging because it requires balancing the immediate need to reduce claim denials with the long-term imperative of maintaining compliance and ethical revenue cycle practices. A hasty or incomplete denial prevention strategy can lead to significant financial repercussions and regulatory scrutiny. Careful judgment is required to identify root causes rather than merely addressing symptoms. The correct approach represents best professional practice because it focuses on proactive, data-driven root cause analysis and systemic improvements. By identifying specific payer policies, coding inaccuracies, or documentation gaps, the organization can implement targeted training and process changes. This aligns with the principles of accurate billing and coding, which are fundamental to compliant revenue cycle management. Furthermore, a systematic approach to denial prevention demonstrates a commitment to operational efficiency and financial integrity, which are core tenets of executive-level revenue cycle responsibility. This proactive stance minimizes the risk of future denials and ensures adherence to payer agreements and regulatory requirements. An incorrect approach that focuses solely on appealing existing denials without addressing the underlying causes is professionally unacceptable. This is because it represents a reactive, inefficient use of resources and fails to prevent future denials. Ethically, it can be seen as a failure to uphold the organization's responsibility to submit accurate claims from the outset. From a regulatory standpoint, a persistent pattern of denials due to preventable errors could indicate a lack of internal controls and a potential violation of payer contract terms, which often stipulate accurate claim submission. Another incorrect approach that involves bypassing established documentation or coding review processes to expedite claim submission is also professionally unacceptable. This directly compromises the accuracy of claims, increasing the likelihood of denials and potential recoupments. It also introduces significant compliance risks, as it deviates from established regulatory guidelines for medical necessity and coding. Such an approach undermines the integrity of the revenue cycle and can lead to accusations of fraudulent billing practices, a severe ethical and regulatory failure. The professional reasoning process for similar situations should involve a structured approach. 1. Data collection and analysis. Gather comprehensive data on denial trends, including denial reason codes, payer types, and service lines. 2. Root cause identification. Move beyond superficial reasons to identify the underlying systemic issues, e.g., training gaps, process inefficiencies, policy misunderstandings. 3. Strategy development. Design targeted interventions based on identified root causes, prioritizing those with the greatest impact on denial reduction and compliance. 4. Implementation and monitoring. Execute the strategy with clear ownership and timelines, and establish robust monitoring mechanisms to track progress and make adjustments. 5. Continuous improvement. Foster a culture of ongoing evaluation and refinement of denial prevention strategies. Question 10. Benchmark analysis indicates that a significant portion of claim denials in the healthcare industry stem from issues related to patient insurance coverage. Considering the regulatory framework governing revenue cycle operations in the United States, which of the following approaches to verifying insurance eligibility before rendering services is most aligned with best professional practice and regulatory compliance? Option A. Conducting eligibility verification solely through manual phone calls to insurance providers, accepting their verbal confirmation as definitive without further documentation. Option B. Utilizing historical patient data to estimate the likelihood of current insurance coverage, with verification only occurring if a claim is subsequently denied. Option C. Implementing automated, real-time or near real-time eligibility verification processes that confirm patient coverage and benefits at the point of scheduling or prior to service delivery. Option D. Relying primarily on patient-provided insurance information and only performing manual eligibility checks for a small percentage of high-risk cases. The correct answer is C. Implementing automated, real-time or near real-time eligibility verification processes that confirm patient coverage and benefits at the point of scheduling or prior to service delivery. Explanation: this scenario is professionally challenging because it requires balancing efficient revenue cycle operations with accurate patient financial responsibility determination, all while adhering to strict regulatory requirements. The pressure to reduce claim denials and accelerate payment cycles can tempt revenue cycle professionals to adopt shortcuts. However, the regulatory framework for revenue cycle management, particularly concerning insurance eligibility verification, mandates a thorough and accurate process to protect both the patient and the provider. The correct approach represents best professional practice because it prioritizes patient financial clarity and regulatory compliance. By performing real-time or near real-time eligibility checks, revenue cycle professionals ensure that services rendered are covered by the patient's insurance plan to the extent of their benefits. This proactive verification minimizes the risk of unexpected patient balances, reduces claim denials due to eligibility issues, and aligns with the ethical obligation to provide transparent financial information to patients. Adherence to these practices is often implicitly or explicitly required by payers and regulatory bodies like CMS, Centers for Medicare and Medicaid Services, in the U.S., which emphasize accurate patient registration and benefit verification to prevent fraud, waste, and abuse, and to ensure appropriate billing. An incorrect approach that relies solely on historical data or manual, infrequent checks fails to account for dynamic changes in insurance plans, such as policy lapses, changes in coverage, or enrollment status updates that can occur between the time of scheduling and the date of service. This can lead to significant financial discrepancies for patients, potentially resulting in bad debt for the provider and patient dissatisfaction. Ethically, it violates the principle of transparency and fairness in financial dealings with patients. From a regulatory standpoint, such an approach could be seen as a failure to exercise due diligence in verifying coverage, potentially leading to improper billing practices and noncompliance with payer contracts and federal regulations governing healthcare billing. Another incorrect approach might involve accepting a patient's self-reported insurance information without independent verification. While patient cooperation is valuable, it does not absolve the provider of the responsibility to confirm coverage through official channels. This can lead to billing errors, claim rejection, and disputes over payment responsibility. It also opens the door to potential fraud if insurance information is misrepresented. The professional reasoning process for similar situations should involve a systematic evaluation of available verification tools and processes. Professionals must understand the capabilities and limitations of their chosen methods, ensuring they provide timely and accurate eligibility information. This includes understanding the specific requirements of different payers, the impact of patient demographics on verification processes, and the legal and ethical implications of incomplete or inaccurate verification. A robust revenue cycle management strategy will incorporate technology and workflows that support comprehensive eligibility verification as a foundational step in the revenue cycle, rather than an afterthought. Question 11. Regulatory review indicates that a healthcare organization's billing department has implemented a new policy to submit all patient claims immediately upon patient discharge, regardless of specific payer filing deadlines. This approach aims to expedite the revenue cycle. However, it has led to an increase in claim rejections due to untimely filing for certain payers. Which of the following billing process adjustments best aligns with regulatory compliance and sound revenue cycle management principles? Option A. Continue submitting all claims immediately upon discharge and focus on appealing denied claims due to untimely filing. Option B. Prioritize submitting claims only to payers with the shortest filing deadlines and address other payers later. Option C. Implement a system that tracks and adheres to each payer's specific claim submission timelines, ensuring claims are filed within the allowed window for each respective payer. Option D. Delay the submission of all claims until the end of the month to allow for complete account reconciliation before billing. The correct answer is C. Implement a system that tracks and adheres to each payer's specific claim submission timelines, ensuring claims are filed within the allowed window for each respective payer. Explanation: this scenario presents a common challenge in revenue cycle management, balancing the need for timely billing to ensure prompt payment with the imperative to adhere to payer-specific billing timelines and regulatory requirements. The professional challenge lies in navigating the complex web of contractual obligations, payer policies, and regulatory mandates that dictate when claims can be submitted. Failure to comply can lead to claim denials, delayed reimbursement, and potential penalties, impacting the financial health of the healthcare organization. Careful judgment is required to implement billing processes that are both efficient and compliant. The correct approach represents best professional practice because it prioritizes adherence to payer contracts and regulatory guidelines, specifically the Centers for Medicare and Medicaid Services, CMS, regulations, and HIPAA. By establishing internal workflows that align with these external requirements, the organization minimizes the risk of claim rejections due to untimely filing. This proactive stance ensures that claims are submitted within the allowed windows, maximizing the likelihood of clean claims and timely payment, which is a core objective of revenue cycle management. This approach demonstrates a commitment to regulatory compliance and sound financial stewardship. An incorrect approach that involves submitting claims immediately upon patient discharge, without verifying payer-specific filing deadlines, represents a significant regulatory and ethical failure. This practice disregards contractual obligations and payer policies, which often stipulate specific timeframes for claim submission. Such a failure can lead to claim denials for untimely filing, directly violating the principle of accurate and timely reimbursement. Furthermore, it demonstrates a lack of due diligence in understanding and applying the rules governing healthcare billing, potentially leading to financial losses for the organization and increased administrative burden. Another incorrect approach, delaying submission of claims until all patient account information is fully reconciled, even if it exceeds payer filing deadlines, is also professionally unacceptable. While reconciliation is important, it should not supersede regulatory and contractual timelines. This delay can result in claims being rejected for untimely filing, a direct contravention of payer agreements and CMS guidelines. Ethically, it fails to act in the best interest of the organization by unnecessarily jeopardizing reimbursement. This approach prioritizes internal process completion over external compliance requirements, leading to preventable financial setbacks. The professional reasoning process for similar situations should involve a thorough understanding of all applicable payer contracts and regulatory frameworks, including CMS guidelines and HIPAA. Professionals must develop and implement billing workflows that are designed to meet these external deadlines. This requires ongoing education and monitoring of payer policies. When faced with conflicting internal processes and external requirements, the professional decision-making process must prioritize compliance with regulations and contracts. This involves evaluating the potential financial and operational impact of different approaches and selecting the one that best mitigates risk while maximizing compliant revenue capture. Question 12. The control framework reveals a persistent denial pattern for a high-cost specialty medication, with the primary denial reason cited by multiple payers as lack of medical necessity. This trend has significantly impacted the organization's revenue cycle performance and patient access to treatment. Which of the following actions represents the most effective and ethically sound approach to addressing this root cause? Option A. Focus on refining the billing and coding processes to ensure that all submitted claims accurately reflect the services provided, assuming the clinical documentation is inherently sufficient. Option B. Mandate that all prescriptions for this medication be automatically flagged for a secondary review by a senior physician, regardless of the initial clinical assessment, to ensure stricter adherence to medical necessity. Option C. Implement a mandatory, in-depth training program for all clinical staff on documenting specific criteria that support medical necessity for this medication, focusing on the nuances of each payer's policy. Option D. Increase the number of staff dedicated to appealing these denials, prioritizing those with the highest dollar value to recover lost revenue. The correct answer is C. Implement a mandatory, in-depth training program for all clinical staff on documenting specific criteria that support medical necessity for this medication, focusing on the nuances of each payer's policy. Explanation. The control framework reveals a recurring pattern of denials related to medical necessity for a specific high-cost drug. This scenario is professionally challenging because it requires a deep dive into the root cause of these denials, balancing financial stewardship with patient care and adherence to payer policies. The executive must navigate complex clinical documentation, payer guidelines, and internal processes to identify the fundamental issue, rather than just addressing the symptoms. The correct approach involves a systematic, cross-functional root cause analysis. This means engaging clinical staff, coding specialists, billing departments, and potentially even the drug manufacturer's representatives. The goal is to identify whether the denials stem from insufficient clinical documentation supporting medical necessity, incorrect coding practices, misinterpretation of payer policies, or a breakdown in the prior authorization process. This comprehensive investigation aligns with the ethical obligation to ensure accurate billing and claims submission, as well as the professional responsibility to advocate for appropriate patient care. By identifying the true root cause, the organization can implement targeted, sustainable solutions that reduce future denials, improve revenue cycle efficiency, and ultimately benefit patients by ensuring access to necessary treatments. This proactive and thorough approach is best professional practice as it addresses systemic issues, promotes continuous improvement, and upholds the integrity of the revenue cycle. An incorrect approach would be to simply increase the volume of prior authorization requests without addressing the underlying documentation or policy issues. This merely shifts the burden and does not solve the problem, potentially leading to burnout and continued denials. Another incorrect approach is to focus solely on appealing individual denials without understanding the systemic cause. While appeals are necessary, a reactive strategy without root cause analysis is inefficient and unsustainable. A third incorrect approach is to blame specific departments or individuals without a thorough investigation. This fosters a negative work environment and distracts from identifying the true systemic flaws. These approaches fail to meet the ethical and professional standards of the certified revenue cycle executive by not diligently seeking to understand and rectify the fundamental issues leading to financial loss and potential disruption of patient care. They represent a superficial response rather than a commitment to operational excellence and ethical practice. Professionals should approach such situations by first acknowledging the pattern of denials as a symptom of a potential underlying problem. They should then initiate a structured problem-solving process, which includes forming a cross-functional team, gathering relevant data, denial reasons, patient demographics, drug utilization, payer policies, and employing root cause analysis methodologies, e.g., fishbone diagrams, the 5 whys. The focus should always be on identifying systemic issues and developing evidence-based solutions, rather than assigning blame or implementing quick fixes. This methodical approach ensures that resources are used effectively and that long-term improvements are achieved. Question 13. The performance metrics show that medical necessity denials have increased by 15% in the last quarter, while incomplete/inaccurate registration denials remain the highest volume category but have remained stable. Which approach best addresses the root cause of these denial trends for optimal revenue cycle performance? Option A. Analyze the medical necessity denial trends by payer and service line to pinpoint specific documentation or authorization issues that may have recently changed. Option B. Conduct a comprehensive review of the medical necessity denial appeals process to identify any inefficiencies and ensure timely submission of supporting documentation. Option C. Focus immediate efforts on resolving the highest volume denial category, incomplete/inaccurate registration, as it represents the largest number of denied claims. Option D. Implement mandatory retraining for all frontline registration staff on accurate data capture and verification procedures. The correct answer is B. Conduct a comprehensive review of the medical necessity denial appeals process to identify any inefficiencies and ensure timely submission of supporting documentation. Explanation. This scenario presents a common challenge in revenue cycle management, identifying the root cause of claim denials to implement effective preventative measures. The professional challenge lies in distinguishing between systemic issues that require broad process changes and individual errors that might be addressed through targeted training or system adjustments. A deep understanding of denial types and their underlying causes is crucial for accurate root cause analysis and the development of sustainable solutions. The correct approach represents best professional practice because it prioritizes a systematic and data-driven investigation into the most frequent denial categories. By focusing on the top denial reasons, revenue cycle professionals can allocate resources most effectively to address the issues with the greatest financial impact and potential for improvement. This aligns with the principles of efficient revenue cycle management, aiming to reduce preventable denials and optimize cash flow. Furthermore, this approach supports compliance by ensuring that denial trends are identified and addressed, which can be a factor in payer audits and performance reviews. An incorrect approach that focuses solely on the most recent denials fails to consider the overall volume and impact of different denial types. This could lead to addressing minor issues while overlooking significant, recurring problems that drain resources and negatively affect revenue. Such a reactive approach is not proactive and does not represent best practice in revenue cycle management. Another incorrect approach that attributes all denials to front-end registration errors is an oversimplification. While registration errors are a common cause of denials, they are not the sole cause. This narrow focus ignores potential issues in coding, medical necessity documentation, payer policy adherence, or billing submission errors, leading to an incomplete root cause analysis and ineffective solutions. This can result in continued denials from other categories, impacting financial performance and potentially leading to non-compliance with payer requirements for accurate and timely claim submission. A professional reasoning process for similar situations involves 1. Data aggregation. Collect comprehensive denial data over a defined period. 2. Categorization. Accurately categorize denials based on established denial reason codes. 3. Prioritization. Rank denial categories by frequency and financial impact. 4. Root cause analysis. For the top denial categories, conduct a thorough investigation to identify the underlying cause, e.g., system configuration, process breakdown, training gaps, payer policy misunderstanding. 5. Solution development. Implement targeted interventions based on the identified root causes. 6. Monitoring and evaluation. Continuously track denial trends and the effectiveness of implemented solutions. Question 14. Implementation of a new electronic health record (EHR) system has led to an increase in coding errors identified during the pre-billing audit process. The revenue cycle team is tasked with resolving these discrepancies before claims are submitted to payers. Which of the following approaches best ensures regulatory compliance and accurate reimbursement? Option A. Prioritize correcting only those discrepancies that are likely to result in significant payment differences, deferring minor coding adjustments to a later date to expedite overall claim submission. Option B. Conduct a detailed review of the medical record documentation for each identified discrepancy, cross-referencing the physician's notes, test results, and operative reports against the assigned ICD-10-CM and CPT codes to ensure they accurately reflect the services rendered and the patient's condition, and then reassign codes as necessary based on established coding guidelines and payer policies. Option C. Immediately correct the codes based on the most common coding patterns observed in the EHR for similar patient encounters, assuming the EHR's default coding suggestions are generally accurate. Option D. Rely on the EHR system's automated flagging of potential errors and proceed with billing once the flags are cleared, without further manual verification of the underlying documentation. Correct answer is B. Conduct a detailed review of the medical record documentation for each identified discrepancy, cross-referencing the physician's notes, test results, and operative reports against the assigned ICD-10-CM and CPT codes to ensure they accurately reflect the services rendered and the patient's condition, and then reassign codes as necessary based on established coding guidelines and payer policies. Explanation: this scenario presents a common challenge in revenue cycle management, ensuring accurate coding and billing practices while navigating evolving regulatory landscapes. The professional challenge lies in balancing the need for timely reimbursement with the imperative of strict adherence to coding guidelines and payer policies, which are subject to frequent updates and interpretations. Careful judgment is required to avoid both undercoding, which can lead to lost revenue and potential compliance issues, and overcoding, which constitutes fraud and abuse. Correct approach represents best professional practice because it prioritizes a systematic and evidence-based method for addressing coding discrepancies. By conducting a thorough review of medical documentation against established coding standards, such as ICD-10-CM and CPT codes, and payer-specific guidelines, the revenue cycle team ensures that claims accurately reflect the services rendered. This proactive stance minimizes the risk of claim denials, audits, and penalties, thereby safeguarding the organization's financial health and reputation. It aligns with the ethical obligation to bill truthfully and transparently. An incorrect approach that involves simply accepting the initial coding without verification fails to uphold professional standards. This oversight can lead to the submission of inaccurate claims, potentially resulting in overpayments or underpayments, both of which have significant financial and compliance ramifications. It demonstrates a lack of due diligence and a disregard for the detailed requirements of coding and billing regulations. Another incorrect approach, which might involve making assumptions about payer intent or applying broad interpretations of coding rules to expedite billing, is highly problematic. This practice can easily cross the line into fraudulent activity, as it deviates from established coding principles and can be construed as an attempt to improperly increase reimbursement. Such actions violate the integrity of the billing process and expose the organization to severe legal and financial penalties. The professional reasoning process for similar situations should involve a multi-step approach. First, thoroughly understand the specific coding and billing regulations applicable to the services provided and the payers involved. Second, establish clear internal policies and procedures for coding and billing that are regularly updated to reflect regulatory changes. Third, implement robust internal auditing processes to identify and correct coding errors before claims are submitted. Fourth, provide ongoing education and training to coding and billing staff on best practices and regulatory updates. Finally, foster a culture of compliance where staff feel empowered to question and verify coding decisions, ensuring that all claims are accurate, compliant, and ethically sound. Question 15. Compliance review shows a pattern of significant billing discrepancies leading to patient complaints and potential underpayments from payers. The revenue cycle executive is tasked with addressing this issue promptly. Which of the following actions best represents a professional and compliant approach to resolving these discrepancies? Option A. Focus solely on retraining front-end registration staff to prevent future errors, assuming all discrepancies originate from the initial patient intake process. Option B. Initiate an immediate, in-depth audit of the billing processes, involving cross-functional teams to identify root causes, and develop a remediation plan that includes patient communication strategies and process improvements. Option C. Implement a temporary moratorium on all patient collections for disputed claims, while simultaneously demanding immediate process changes from the billing department without a thorough investigation. Option D. Immediately write off all claims flagged with discrepancies to avoid further patient dissatisfaction and payer disputes, regardless of the validity of the original charges. The correct answer is B. Initiate an immediate, in-depth audit of the billing processes, involving cross-functional teams to identify root causes, and develop a remediation plan that includes patient communication strategies and process improvements. Explanation: this scenario is professionally challenging because it requires balancing the immediate financial needs of a healthcare provider with the long-term implications of patient trust and regulatory compliance. The revenue cycle executive must navigate the complex relationships between various stakeholders, each with distinct priorities and expectations. Careful judgment is required to ensure that actions taken to improve revenue capture do not inadvertently harm patient relationships or violate established healthcare regulations. The correct approach represents best professional practice because it prioritizes a comprehensive, data-driven investigation into the root causes of the identified billing discrepancies. This aligns with the ethical obligation to ensure accurate billing and to provide transparent communication with patients. By involving relevant internal departments and potentially external auditors, the revenue cycle executive demonstrates a commitment to due diligence and a proactive stance in addressing systemic issues. This approach upholds the principles of fairness and accuracy in financial transactions, which are fundamental to maintaining patient confidence and adhering to healthcare billing regulations. An incorrect approach that focuses solely on aggressive collection tactics without investigating the underlying billing errors would be professionally unacceptable. This would likely lead to patient dissatisfaction, increased complaints, and potential regulatory scrutiny for unfair or deceptive billing practices. Such an approach fails to address the core problem, potentially exacerbating it and damaging the provider's reputation. Another incorrect approach that involves immediate write-offs of all disputed claims without proper investigation is also professionally unacceptable. Seemingly a quick fix, it fails to identify and rectify potential systemic issues that could lead to future billing errors. This approach also represents a potential loss of legitimate revenue and may not satisfy regulatory requirements for proper claim adjudication and documentation. A third incorrect approach that involves blaming specific departments or individuals without a thorough, objective review is professionally unsound. This can create a toxic work environment, hinder collaboration, and prevent the identification of true systemic weaknesses. It also bypasses the necessary due diligence required to understand the full scope of the problem and implement effective, sustainable solutions. The professional reasoning process for similar situations should involve a systematic approach. 1. Identify the core issue. Clearly define the problem based on the compliance review findings. 2. Gather information. Collect all relevant data including billing records, patient communications, and departmental procedures. 3. Analyze root causes. Investigate why the discrepancies are occurring considering process, technology, and human factors. 4. Consult stakeholders. Engage with relevant internal departments e.g., HIM, patient access, billing, IT, and potentially external experts. 5. Develop solutions. Propose corrective actions that address the root causes and align with regulatory requirements and ethical standards. 6. Implement and monitor. Put solutions into practice and establish metrics to track their effectiveness. 7. Communicate transparently. Maintain open communication with patients and internal teams throughout the process. Question 16. The evaluation methodology shows that while one approach emphasizes the speed of initial claim submission as the primary driver of revenue cycle efficiency, another approach advocates for a comprehensive analysis of key performance indicators, including denial rates, clean claim submission percentages, and net collection rates, to assess overall revenue cycle health. Which of these approaches best aligns with the principles of effective revenue cycle management and regulatory compliance for a certified revenue cycle executive? Option A. The approach that advocates for a comprehensive analysis of key performance indicators, including denial rates, clean claim submission percentages, and net collection rates, to assess overall revenue cycle health. Option B. An approach that focuses solely on maximizing gross charges without considering net collection rates. Option C. The approach that emphasizes the speed of initial claim submission as the primary driver of revenue cycle efficiency. Option D. An approach that prioritizes patient satisfaction scores without linking them to the financial implications of the revenue cycle. The correct answer is A. The approach that advocates for a comprehensive analysis of key performance indicators, including denial rates, clean claim submission percentages, and net collection rates, to assess overall revenue cycle health. Explanation. The evaluation methodology shows a critical juncture in assessing revenue cycle performance where different interpretations of key performance indicators, KPI, can lead to divergent strategic decisions. Challenge lies in discerning which KPIs most accurately reflect the financial health and operational efficiency of the revenue cycle, especially when faced with varying data presentation methods and the potential for misinterpretation. A robust evaluation requires understanding the interconnectedness of KPIs and their impact on overall revenue capture and patient satisfaction, all within the established regulatory framework for healthcare revenue management. Now, the correct approach represents best professional practice because it prioritizes a holistic view of the revenue cycle, aligning KPIs with the overarching goals of financial sustainability, regulatory compliance, and patient experience. This approach recognizes that a single KPI in isolation can be misleading. For instance, focusing solely on days in accounts receivable are, without considering denial rates or collection effectiveness, could mask underlying issues. Best practice dictates a balanced scorecard approach, where KPIs are analyzed in conjunction with each other and benchmarked against industry standards and internal historical data. This aligns with the principles of sound financial management and operational excellence expected of certified revenue cycle executives, ensuring that decisions are data-driven and contribute to long-term organizational success. An incorrect approach that focuses exclusively on the speed of claim submission without considering the accuracy of the submitted information is professionally unacceptable. This fails to adhere to regulatory requirements for accurate billing and coding, potentially leading to claim denials and subsequent rework, which increases costs and delays revenue. Such a narrow focus ignores the fundamental principle of clean claims and can result in a false sense of efficiency. Another incorrect approach that prioritizes maximizing gross charges without a corresponding focus on net collection rates is also professionally unsound. This strategy can inflate perceived revenue, but does not reflect actual cash collected. It can lead to poor payer contract management and an inability to negotiate favorable terms, ultimately impacting profitability. This approach neglects the ethical obligation to accurately represent financial performance and can mislead stakeholders. Finally, an approach that solely examines patient satisfaction scores without linking them to the financial implications of the revenue cycle, e.g., billing clarity payment options, is incomplete. While patient satisfaction is crucial, a revenue cycle executive must understand how operational and financial processes contribute to or detract from it. Ignoring this link means missing opportunities to improve both patient experience and revenue capture. The professional decision-making process for similar situations should involve a systematic evaluation of all relevant KPIs, understanding their interdependencies, and considering their impact on financial, operational, and patient outcomes. Professionals should always refer to established industry best practices and regulatory guidelines to ensure their evaluations are comprehensive and compliant. This involves asking critical questions. Does this KPI accurately reflect our financial performance? Does it align with our strategic objectives? Does it consider regulatory compliance? Does it impact patient experience? By answering these questions, a revenue cycle executive can make informed decisions that drive sustainable success. Question 17. Stakeholder feedback indicates that patients are experiencing confusion and dissatisfaction regarding their out-of-pocket healthcare costs. In response, a healthcare organization is reviewing its patient financial counseling and estimate processes. Which of the following approaches best aligns with regulatory requirements and professional best practices for providing accurate and transparent financial estimates to patients? Option A. Require a minimum deposit payment from all patients at the time of scheduling, with a verbal explanation that the final bill may vary based on insurance adjudication. Option B. Implement a standardized process where all patients receive a detailed, written estimate of anticipated service costs, including expected insurance coverage and patient responsibility, prior to service delivery. This estimate will also clearly outline available financial assistance programs and provide contact information for further questions. Option C. Delay comprehensive financial counseling until after the patient has completed their medical services, at which point a billing specialist will review the patient's account and explain their financial obligations. Option D. Provide a general range of potential costs for common procedures during the initial scheduling call, with the expectation that a detailed bill will be sent after services are rendered and insurance has processed the claim. The correct answer is B. Implement a standardized process where all patients receive a detailed, written estimate of anticipated service costs, including expected insurance coverage and patient responsibility, prior to service delivery. This estimate will also clearly outline available financial assistance programs and provide contact information for further questions. Explanation. This scenario is professionally challenging because it requires balancing the organization's financial health with the patient's right to understand their financial obligations. The certified revenue cycle executive must navigate complex regulatory requirements, ethical considerations, and the need for clear, accessible communication to ensure patient satisfaction and compliance. The correct approach represents best professional practice because it prioritizes patient education and transparency, aligning with the principles of patient-centered care and regulatory mandates for clear financial disclosure. Providing a comprehensive, written estimate that details all potential charges, insurance coverage, and patient responsibility, along with clear explanations of available financial assistance programs, empowers patients to make informed decisions and reduces downstream billing disputes. This proactive approach fosters trust and adherence to payment obligations. An incorrect approach that focuses solely on collecting a deposit without a detailed estimate fails to meet regulatory requirements for transparency and may violate patient protection laws by not adequately informing the patient of their financial liability. This can lead to patient dissatisfaction, complaints, and potential legal repercussions. Another incorrect approach that provides a vague, verbal estimate without written documentation lacks the necessary clarity and accountability. This can result in misunderstandings, disputes over charges, and a failure to comply with regulations requiring written financial disclosures. It also undermines the patient's ability to plan for their healthcare expenses. A third incorrect approach that delays providing financial counseling until after services are rendered is a significant failure. This not only deprives the patient of the opportunity to understand their financial obligations beforehand, but also creates a reactive, rather than proactive revenue cycle management process. It can lead to patients being overwhelmed by unexpected bills, impacting their ability to pay and potentially leading to bad debt. The professional reasoning process for similar situations should involve a thorough understanding of all applicable regulations, e.g., HIPAA for privacy of financial information, CMS guidelines for billing and patient rights, state-specific consumer protection laws. It requires a commitment to ethical practice, emphasizing honesty, fairness, and patient advocacy. Professionals should implement standardized processes for financial counseling, ensuring that all patients receive consistent and accurate information. Regular training for staff on communication techniques, regulatory updates, and available financial assistance programs is crucial. Furthermore, establishing clear channels for patient inquiries and feedback allows for continuous improvement of the financial counseling process. Question 18. Investigation of a healthcare organization's revenue cycle reveals a persistent pattern of claim denials and underpayments attributed to coding errors. The Chief Revenue Officer is considering several strategies to address this issue. Which of the following approaches is most likely to lead to sustainable improvement in coding accuracy and optimize reimbursement while adhering to regulatory compliance? Option A. Implement a comprehensive coder education and ongoing training program, coupled with a robust internal audit process that provides timely feedback and corrective action plans for coders. Option B. Shift the primary responsibility for coding to physicians, providing them with basic coding guidelines and expecting them to assign all necessary codes. Option C. Increase coder productivity targets by 20% to process claims more rapidly, assuming that a higher volume of claims will eventually lead to more revenue. Option D. Focus solely on analyzing claim denial reports to identify coding errors, and then address those specific instances retrospectively. The correct answer is A. Implement a comprehensive coder education and ongoing training program, coupled with a robust internal audit process that provides timely feedback and corrective action plans for coders. Explanation. This scenario presents a common implementation challenge in revenue cycle management. Ensuring accurate coding practices are consistently applied across a large healthcare organization to optimize reimbursement. The professional challenge lies in balancing the need for timely and complete documentation with the complexity of coding guidelines and the potential for human error or misinterpretation. The pressure to meet performance metrics can inadvertently incentivize shortcuts or less rigorous review processes, leading to downstream financial and compliance risks. The correct approach emphasizes a multifaceted strategy that addresses the root causes of coding inaccuracies. This involves robust training programs tailored to different roles, regular audits with constructive feedback loops, and the implementation of technology to support coders. This approach aligns with the principles of accurate financial reporting and compliance with payer regulations, which mandate that claims submitted reflect the services rendered and are coded according to established standards. By proactively investing in coder education and quality assurance, the organization minimizes the risk of claim denials, underpayments, and potential audits, thereby safeguarding its revenue stream and reputation. An incorrect approach that focuses solely on increasing coder productivity without a corresponding emphasis on accuracy overlooks the fundamental requirement for correct coding. This can lead to a higher volume of inaccurately coded claims, increasing the likelihood of denials and recoupments, which ultimately harms the revenue cycle. Such an approach may also violate payer contracts and federal regulations, e.g., the False Claims Act in the U.S., if applicable to the exam's jurisdiction, that require accurate representation of services. Another incorrect approach that relies solely on retrospective claim denial analysis to identify coding issues is reactive rather than proactive. While denial analysis is important, it means that errors have already occurred and impacted reimbursement. This approach fails to prevent errors upstream, leading to ongoing financial leakage and increased administrative burden to correct past mistakes. It also misses opportunities to educate coders and improve processes before claims are submitted. A third incorrect approach that delegates coding responsibility entirely to physicians without adequate coder support or oversight is also problematic. While physician documentation is crucial, physicians may not always be up to date on the nuances of coding guidelines, which are constantly evolving. This can lead to inconsistent or incorrect coding, impacting reimbursement and compliance. It also places an undue burden on physicians, diverting their focus from patient care. The professional decision-making process for such situations requires a commitment to a comprehensive revenue cycle strategy. This involves understanding the interplay between clinical documentation, coding, billing, and payer policies. Professionals must prioritize accuracy and compliance, recognizing that short-term gains in productivity achieved through compromised quality are unsustainable and carry significant risks. A data-driven approach, utilizing audits and performance metrics to identify areas for improvement, coupled with continuous education and technological support, forms the bedrock of effective revenue cycle management. Question 19. What factors determine the ethical and compliant approach to charge capture when faced with pressure to increase revenue, particularly when there's a temptation to bill for services that may not be fully documented or were not entirely rendered? Option A. The urgency of meeting departmental revenue targets and the manager's directive to maximize billable services regardless of documentation. Option B. The perceived financial needs of the organization and the likelihood of a payer audit in the current fiscal year. Option C. The extent to which documentation supports the services billed, adherence to payer-specific billing guidelines, and the potential for regulatory scrutiny. Option D. The ease of obtaining patient consent for estimated charges and the historical billing practices of similar healthcare facilities. The correct answer is C. The extent to which documentation supports the services billed, adherence to payer-specific billing guidelines, and the potential for regulatory scrutiny. Explanation. This scenario presents a common ethical dilemma in revenue cycle management, specifically concerning charge capture. The challenge lies in balancing the organization's financial health with the imperative of accurate and compliant billing. A revenue cycle professional must navigate the pressure to maximize revenue while upholding ethical standards and adhering to regulatory requirements. The core of the dilemma is whether to prioritize immediate financial gain through potentially questionable charge capture practices or to maintain integrity and long-term compliance, even if it means foregoing immediate revenue. The correct approach prioritizes accurate and compliant charge capture by ensuring that all services rendered are properly documented and coded, and that only those services are billed. This aligns with the fundamental principles of ethical revenue cycle management and regulatory compliance. Specifically, in the U.S. healthcare system, this approach adheres to the False Claims Act, which prohibits knowingly submitting or causing to be submitted false or fraudulent claims for payment to the government. It also aligns with Medicare and Medicaid billing guidelines, which mandate that providers bill only for services that are medically necessary, properly documented, and actually provided. This approach fosters trust with payers, patients, and regulatory bodies, and mitigates the risk of significant financial penalties, reputational damage, and legal repercussions. An incorrect approach that involves rounding up charges or billing for services not fully rendered is ethically unsound and legally perilous. This practice directly violates the False Claims Act by submitting fraudulent claims. It also contravenes the principles of fair billing and patient trust. Such actions can lead to severe consequences, including audits, recoupments of payments, civil monetary penalties, exclusion from federal healthcare programs, and even criminal prosecution. Another incorrect approach, such as ignoring potential charge capture errors to avoid additional work or scrutiny, is also professionally unacceptable. This demonstrates a lack of due diligence and a failure to uphold the fiduciary responsibility to the organization and its patients. It can result in underbilling or overbilling, both of which can lead to financial instability and compliance issues. The professional decision-making process for similar situations should involve a thorough understanding of all applicable regulations, e.g., HIPAA, Stark Law, Anti-Kickback Statute, Medicare/Medicaid guidelines, organizational policies, and ethical codes. When faced with a situation that could compromise compliance or ethical standards, a revenue cycle professional should 1. Gather all relevant facts and documentation. 2. Consult internal compliance officers, legal counsel, or subject matter experts. 3. Evaluate the potential risks and benefits of each course of action, considering both financial and compliance implications. 4. Prioritize patient care and accurate billing over immediate financial gains. 5. Document all decisions and the rationale behind them. 6. Advocate for robust internal controls and continuous process improvement to prevent future issues. Question 20. When evaluating the impact of common charge capture errors on a healthcare organization's financial health and regulatory compliance, which of the following approaches best demonstrates a commitment to proactive risk mitigation and adherence to revenue cycle best practices? Option A. Implementing a robust system for identifying, analyzing, and rectifying charge capture errors at their source, focusing on root cause analysis and continuous process improvement to prevent recurrence. Option B. Prioritizing the rapid submission of all charges to maximize immediate cash flow, with a secondary focus on addressing denials that arise from potential charge capture inaccuracies. Option C. Establishing a dedicated team to manage claim denials, with the primary objective of appealing or correcting claims after they have been submitted, regardless of the initial charge capture process. Option D. Focusing only on charge capture errors that result in significant financial losses, while overlooking smaller discrepancies to conserve administrative resources. The correct answer is A. Implementing a robust system for identifying, analyzing, and rectifying charge capture errors at their source, focusing on root cause analysis and continuous process improvement to prevent recurrence. Explanation: this scenario is professionally challenging because it requires a revenue cycle executive to identify and address systemic issues that directly impact financial integrity and regulatory compliance. The challenge lies in moving beyond simply identifying errors to understanding their root causes and implementing sustainable solutions that prevent recurrence, all while navigating complex regulatory landscapes. Careful judgment is required to prioritize interventions, allocate resources effectively, and ensure that all actions align with ethical standards and legal requirements. The correct approach represents best professional practice because it focuses on a comprehensive, data-driven analysis of charge capture errors and their downstream effects. This proactive stance not only rectifies immediate financial losses, but also strengthens internal controls, improves coding accuracy, and reduces the risk of non-compliance with payer rules and government regulations. By identifying the root causes, such as inadequate training, system deficiencies, or process breakdowns, the executive can implement targeted corrective actions. This aligns with the ethical obligation to maintain accurate financial records and the regulatory imperative to adhere to billing and coding guidelines, preventing potential audits, penalties, and reputational damage. An incorrect approach that focuses solely on retrospective denial management without addressing the upstream charge capture process fails to tackle the fundamental problem. This leads to a reactive cycle of fixing errors after they have occurred, increasing administrative burden and perpetuating financial leakage. Ethically, this demonstrates a lack of diligence in safeguarding the organization's financial health and compliance. From a regulatory standpoint, it can be seen as a failure to implement effective compliance programs designed to prevent improper billing practices. Another incorrect approach that prioritizes speed of billing over accuracy, even if it temporarily boosts cash flow, is ethically unsound and regulatorily risky. This can lead to the submission of inaccurate claims, which is a violation of payer contracts and federal/state laws, e.g., False Claims Act in the U.S. Such a practice can result in significant financial penalties, recoupments, and exclusion from government healthcare programs. It undermines the principle of honest and accurate representation of services rendered. A third incorrect approach that involves ignoring minor charge capture errors due to perceived low financial impact is also professionally unacceptable. While individual errors may seem insignificant, their cumulative effect can be substantial. Furthermore, a pattern of overlooking errors, even minor ones, can signal a breakdown in internal controls and create an environment where more significant compliance issues can arise undetected. This approach fails to uphold the duty of care in managing the revenue cycle and can lead to systemic weaknesses that attract regulatory scrutiny. The professional decision-making process for similar situations should involve a structured approach. 1. Define the problem, clearly identify the types and frequency of charge capture errors. 2. Quantify the impact, assess the financial and compliance implications of these errors. 3. Root cause analysis, investigate the underlying reasons for the errors. 4. Develop solutions, design targeted interventions to address root causes. 5. Implement and monitor, execute the solutions and continuously track their effectiveness. 6. Educate and train, ensure all relevant staff understand their roles and responsibilities. 7. Regular review, periodically reassess processes and controls to adapt to changes and prevent new issues.